A number of patients are withdrawing their consent for their daughters to be vaccinated against the HPV virus due to adverse publicity over its alleged side effects. That's what the annual conference of the Irish Medical Organisation was told last weekend. One family who no longer support the vaccine are Yvonne and Peter Hollidge. Their daughter Rebecca received the vaccination and they joined me in studio a little earlier. I started by asking Yvonne when Rebecca got the vaccine.
Rebecca got her first vaccine on October 13, and then she got the second dose of the vaccine in November, and she got the third vaccination then in March 14.
When did you start noticing a problem?
We noticed a problem from about 10 days after the first vaccine, but at that time we didn't make a link, so we just thought Rebecca was feeling unwell. And she never ever really recovered from then. There was just little symptoms appearing, flu-like symptoms. And then all of a sudden she was starting to lose her memory a bit. She'd forget things. She would drop out of conversations. She'd forget she was talking to you. She'd feel nauseous a lot. And all of these things just crept in. But particularly after the third dose of the vaccination, Rebecca's health declined significantly after that, and hasn't changed since then.
And Peter, had you put much thought into whether Rebecca should have the vaccine?
Well, yeah. As educated people, what you try and do is pick out the information that's available to you. And so obviously we read the information supplied by the school or by HSE, and we did a little bit of digging around. We knew there was some concern somewhere, but we thought, okay, it's supposed to be very safe, so let's go ahead with it.
Okay, well, I don't like talking about Rebecca as if she's not there, because I know she's with us. Rebecca, talk me through how you feel. What's your average day like now?
Well, it's kind of weird because I'm not up during the day. I don't have a normal sleeping pattern. So I'm up all night. So I basically spend all that in bed. I don't really leave the house that much because I have to use a wheelchair now.
And how different is your life now to what your life was like going back, say, to 2013?
Well, then I went to school and I did normal things. I played on sports teams, but now I don't.
Yeah, it's essentially before the jab, she did things like she was playing tag rugby. She was doing normal activities that you'd expect from a normal teenage girl, and since then that's just stopped.
This public health doctor told the IMO conference that media coverage of alleged side effects, in particular a recent television programme, are responsible for this trend, as large number of parents withdrawing their consent for their daughters.
Yeah, well, for us, we welcome that because we have seen the devastation that this vaccination causes, and we were not told and we were not given the information that this is what could happen to our daughter if she had the vaccination. Now, we've not made these up. These are in the PIL that we did not receive.
To explain the PIL, that is effectively the information, the patient information leaflet that everybody gets with drugs. Very few people actually go to the trouble of reading it. But you were saying that your argument is that the PIL that was available in the US contained more information than the PIL that was available here.
Yeah, we didn't get it at all. We just got a glossy brochure saying that Rebecca might feel sick on the day. We didn't get any information, and particularly on the patient information leaflet, it does say if your child has a reaction after a dose of the Gardasil vaccination, do not vaccinate them further. And
but is it the reaction, and again, sorry for cutting across you, is it the reaction that Rebecca has experienced, or was it a more benign reaction they were talking about, somebody who mightn't feel
it's listed on the information leaflet, and below the symptoms that Rebecca was displaying that is listed in the information leaflet, it says do not vaccinate further. But of course we weren't aware of that, and Rebecca received 2 further doses of the vaccination.
What do you want to happen now? Because Rebecca is obviously undergoing treatment. Yvonne, what do you want for your daughter? What do you want the HSE to do for your daughter? What do you want the Irish state to do for your daughter?
What I would like to see is a panel of experts set up for our children. To this day, we have not had anyone come to examine Rebecca. Anyone who speaks out in the media about the vaccination, the experts that believe this is safe, none of those people have actually examined any of our sick children. Now, there's currently over 300 girls registered with regret. We need a panel of doctors to assess our girls and to set up a treatment plan for them. They need a panel of experts to take our girls immediately and help them gain their lives back. They have lost everything.
And Peter, the reason for this concern over the uptake of vaccination is that we have what Andrew Wakefield said about the MMR that led to people not getting the MMR, and that was completely debunked as an argument. And that is what's colouring this debate. That's what is affecting, I'd imagine, the way that the medical world is reacting to what your campaign is.
Let me be clear and specific on this. I'm sorry to cut through you, but the MMR was due to this link with autism. Autism wasn't stated on the PIL for the MMR jab as a possible side effect. Everything we are talking about is listed on the Merck's own data with respect to this drug. It is not scaremongering if you're talking about releasing information that exists, that are warnings about this drug.
Okay. And I just want to finish up by asking Rebecca. Rebecca, what do you want to happen?
I want this vaccine to be taken off the market. I want it to be withdrawn. I don't want anyone else to be in the situation I'm in. And it really does upset me that more and more people will end up like me.
At the end of the day, we just want her to get better. We want all our girls to get better.
We're just asking for help because the way it feels at the moment is the term that has been used is injected and neglected, and that's what has happened to Rebecca. She got the vaccination and the HSC have not supported her in any way.
Well, I can't imagine anyone who's listening to Rebecca and how upset she is would do anything other than try to help her in whatever way they can. Rebecca, thank you so much for your bravery in talking to us. Yvonne and Peter Hollidge as well. Thank you so much for joining us.
You're welcome.
Thank you very much, Jonathan. Thank you.
Dr. Ann Hogan is the Vice President of the IMO. She's a Principal Medical Officer in the Midwest, and she was at the IMO conference talking about concerns over the take-up of the vaccine at the weekend. Ann Hogan, it was very hard to listen to Rebecca there. You say people should continue to get this vaccine. What do you say to reassure listeners after what they've just been hearing?
Well, the HPV vaccine has been available around the world since 2006. We've been using it in this country in the routine vaccination schedule since 2010. It has been repeatedly examined by European medicines agencies, by the World Health Organization, Global Advisory Committee on Vaccine Safety, and by the Centers for Disease Control and Prevention in the US. And all of these committees have continually concluded that the vaccine is safe. The safety review of the 2 HPV vaccines in use in Europe was undertaken by the European Medicines Agency in 2015, and this review reaffirmed that HPV vaccines do not cause chronic fatigue syndrome, chronic regional pain syndrome, or postural orthostatic tachycardia syndrome.
In context of what Peter was saying in particular about the patient information leaflet,
yes.
On that extended PIL, perhaps not the version that is distributed here, but in other countries, they list some of the conditions that Rebecca suffers from as being possible side effects. Is that correct?
On the PIL, which is available here, they list some of those side effects as side effects that have been reported in the use of the vaccine. Whenever a new medical product is introduced, particularly vaccines, people are encouraged, particularly in the early use, to make reports of any possible side effects. And all of those things have been reported, but they have not been reported in such numbers as. I don't want to comment on individual cases, but it is very distressing when a previously healthy child develops an illness of any kind. However, just because something occurs close in time to the administration of a vaccine doesn't necessarily mean that the vaccine has caused it. And scientific studies have repeatedly demonstrated that there is no increased incidence of chronic fatigue syndrome with HPV vaccine.
One of the things that the Holliges said quite clearly was that they feel as if they haven't been taken seriously. Even if you don't believe there's a link, they want to meet with more people in the HSE, and they want them to see Rebecca to try and understand where they're coming from, and if to allay their fears, to allay their fears. Do you think more can be done to help the families involved so that they don't feel as isolated as would appear to be the case?
Yeah, well, I suppose the first thing that needs to be done is that the girls who are complaining of these symptoms get appropriate medical treatment, and that all possible associations with the vaccine are investigated. Now, to date, those investigations have been carried out, by the World Health Organization, the European Medicines Agency, and they haven't demonstrated any association with the vaccine.
But in even trying to reassure them, is there a point in public health doctors maybe trying to talk to these families, or at least just trying to assess for themselves in conjunction with what the WHO has been saying about these vaccines?
Well, where they are reported to our services, or the individual doctors do obviously speak to parents about concerns.
Okay, we'll leave it there. Lots of text messages coming in on this, so I'm going to get back to them after 1 o'clock. Thank you for joining us. That was Dr Ann Hogan, who is a Principal Medical Officer in the Midwest of the country. This is HPV vaccine story we covered earlier on. Anam says, I'm in recovery from extensive surgery for gynecological cancer preventable by the HPV vaccine. Please have your daughters vaccinated. My 14-year-old has just been safely vaccinated, says that listener. Another distraught mother, she describes herself, says, my 18-year-old daughter suffered for the last 5 years daily headaches, blurred vision, fatigue, stomach problems, sensitive to light, had major surgery last summer. When is it going to end for these poor girls? And many other parents who are concerned got in contact as well. We're going to post up both interviews on our website, newstalk.com/lunchtime.